Hello, welcome back to my channel, and today I thought I would do an update on what's been happening with my endometriosis and the meds that I'm on and doctor appointments and possibly surgery. So if you didn't watch my last video, we pretty much suspect that I have endometriosis. And how that was diagnosed was I did an MRI like a month ago, and that MRI showed something called an endometrioma, or the non-medical term chocolate cyst. An endometrioma is a type of ovarian cyst filled with endometrial tissue, often referred to as a chocolate cyst, due to its dark reddish brown thick fluid. And because of that finding, my gynecologist was like, yeah, endometriosis, and prescribed me something called Aspen Dynogest, and then also put me on a wait list for a surgeon so that I can get surgery to remove said cyst. So this medication that she prescribed is supposed to help patients that have endometriosis. It is a hormone therapy that tries to lessen your estrogen levels by elevating your progesterone levels, I believe. So it says, this medication is used to treat endometriosis. It works by lowering the amount of certain hormones in the body and decreases the growth of abnormal tissue that causes endometriosis. This helps reduce pain and other symptoms. Dynogest is a type of hormone called progestin. Here's another description because I'm really into making sure that when I make these videos, my information is correct. So it says, Dynogest belongs to the class of medication called progestin, medication that acts like progesterones in the body. Progesterones are female hormones. They are produced by the body and are necessary along with other hormones for normal female sexual development and for the regulation of menstrual cycle during childbearing age. Males also have progesterone, but in low amounts. Progesterone reduces the effects of estrogen on the tissues such as the endometrium lining of the uterus and the breasts. By reducing the growth effects of estrogen on the endometrium, Dynogest helps to reduce the pelvic pain experienced by women with endometriosis. So some of the symptoms that I have experienced while being on this, I take one tablet once a day. I usually take it at around 11 o'clock at night because some of the side effects are sedative-like. So I prefer to be sleepy when I actually need to go to sleep and not have to be sleepy when I take it in the morning. So I actually take this medication with my melatonin. So both, apparently, I've read that this medication reacts to melatonin and sometimes can make it even stronger. So I've been having some good night sleeps. Some people on this medication actually experience the opposite, where they can't sleep, so they sometimes take it during the day so it doesn't affect their sleep. But it seems to be the opposite for me. So it's been working great to make sure that you have to take it at the same time every night, kind of like a birth control. This is not a birth control. It's not recommended for a birth control, but it is, the rules are kind of the same, where if you're taking a birth control, you're supposed to take it every single day at the same time. This works the same way, so I take it around 11 o'clock every single night with my melatonin. That being said, please contact your doctor before doing this to make sure it's safe for you. The two major side effects that I have had with this medication is my period has stopped completely, and I have noticed that my mood has been a little bit all over the place, which has been a little bit difficult. I find that mood-wise, I'm a little bit up and down with my mood. I wouldn't say I'm depressed. Some people do experience some depressive episodes on this medication. I experience more like triggering frustration, like I don't have the best control of when I get upset. I've noticed that I get frustrated with things way more easily, and I'm starting to snap at people a little bit more. It is a hormone, and it is changing my hormones in my body, so it would make sense that my moods right now are a little bit unstable. But I'm hoping over the course of 3 months, because I have been given a 3-month supply of this, that I'm hoping that my moods will stabilize. This medication, like I said before, also has stopped my period, which for right now, I'm not complaining. They do recommend you take this medication the first day of your period. I did not do that. I took it a couple of days beforehand, and I was not expecting it to work so fast, and I thought I was going to get my period, but nope, it just never came this month. So it will be interesting to know if this is now an always thing, as in if I take this medication then my period just doesn't happen, or at some point will my period kind of break through at some point and I start getting a more even period. I have no idea. Right now I kind of hope for the latter. I don't really want my period right now. I've been having my period since I was like 12, and it would be nice to have a break. I know some people don't like not having their period, but for me, I'm okay with taking a break, especially when I've been dealing with low iron and trying to keep my iron levels up. So I often wonder if not having a period will help my body recover in the iron department. And so I've had my period has stopped. My moods are a little bit of a roller coaster, and I've noticed that I get a little bit of night sweats, which is common with this medication. But I tend to sleep through it, so I just like sometimes I changed up my shower routine. So instead of taking a shower at night, I've been taking it in the morning to sort of freshen up. But other than that, it's been a pretty okay ride with this medication. I think this medication has been helping with the pain and inflammation, but I've also been prescribed naproxen for my pain, which I also take twice a day. So that's also been helpful. They're saying naproxen, and if the naproxen, because it's a slow dose, I'll take Tylenol just to help in between if the naproxen is taking a little bit longer to kick in, which helps. If I'm having more of an active day, I sort of use the Tylenol as a buffer, because sometimes I find the naproxen is just not enough. It's enough to keep my pain manageable, but it's not enough to keep the pain away. So the Tylenol really helps with that. Also, we did talk to a pharmacist on how to manage pain, because at first when I was on naproxen, I found that it was taking a really hard time to kick in. Like, I take it in the morning and it wouldn't kick in until 3 in the afternoon, and there'd be a huge pain sort of increase between there. And we learned that the naproxen is a slow release, which sounds good, but it can take a little bit of time for it to work in your body. So the Tylenol helped sort of mitigate that in-between stage. Yet again, talk to your doctor or your pharmacist before playing with medication and painkillers. Now on to surgery update. Really not an update, because I haven't been able to get into an appointment with a surgeon yet. My gynecologist referred me to a surgeon, the first one, and it took 3 weeks before we learned that she actually declined my case because it was too serious and too out of her scope. So that first one got declined. So I moved on to a second one, and we just learned today, so that's been like a 2-week wait, and today we realized that the second one declined because she's all booked up for the year, so I can't get in. Third time's the charm. Drum roll, please. The third one apparently has finally accepted me for just an appointment, but they haven't called me up yet. We kind of found out from my gynecologist, and we're like, hey, update. And they were like, hey, you've been declined, but you've also been accepted. So now we're just waiting for the doctor that's accepted me to call me for an appointment to see what the next step is. So that's been kind of frustrating in waiting for the next step and getting denied, and then being accepted. But I don't know how long it's been since they've accepted me. So now yet again we have to wait for a call. And I don't know when they're gonna get me into an appointment. The appointment could be another month. So it's just been a lot of waiting and frustration in that waiting process. And I don't blame anybody. It's just where I live, that's very much the medical system. And in terms of going through work with endometriosis and the pain, I'm lucky enough that I've been able to continue to work because of, I'm pretty sure this medication and my painkiller regimen has helped a lot. But I have good days and I have some like more yucky days, but they're nothing compared to what they were without any medication. So I'm grateful for that. So yeah, that's my update for you guys when it comes to my endometriosis storyline here. Yay! Not really. But I hope the next update will be I am booked for surgery. It's something that I don't obviously want to do, but I think it's something that has to be done. And I just want to know that at least the cyst is gonna come out, because I think that's what's causing me the most pain. And to know how much the endometriosis, what type of stage I am in the endometriosis department, is something that's sort of weighing heavy on my mind, just not knowing how much damage could be going on in my body. I'm hoping there's like little to no damage, but there could be a case that it could be a lot, but I'm praying that the cyst is just the biggest problem and everything else can be sort of dealt with the medication that I'm on. I would really hope after surgery and after recovery that I will be able to get off of the main painkillers. I'm not a big fan that I've been taking Tylenol for so long because I'm concerned about my liver and kidneys. And I'm not a big fan that I'm taking naproxen every single day because I also have been diagnosed with an autoimmune gastritis condition, and naproxen is known for causing stomach ulcers. And this condition that I have also puts me at risk for stomach ulcers. So the two combined makes me worried that I'm gonna cause issues in my gut. Granted, I was prescribed a special type of naproxen that releases like a stomach lining protection. So the medication doesn't hurt your stomach as bad. I take it 30 minutes before I have to eat. It kind of works like an acid reflux medication. So I just hope that surgery will take out the cyst, and then we'll figure out what the next steps are, and hopefully taking out the cyst will help with pain management. That's what I'm hoping for. But yeah, hopefully the next updates I have for you when it comes to my endometriosis stuff is when my date of surgery is, which hopefully will be sooner rather than later. Thank you guys for listening, and don't forget to like, comment, and subscribe. And I'll see you on the next video. Bye guys!